Happy Wednesday, everyone. We're really excited that this month, the month of July, we are hosting Wellness Wednesdays. This is a special edition that we're bringing to the community so that we can ensure that you have the information needed to be medically healthy and strong. And we have an amazing guest with us, Dr. Diane Banks. She's been with us last year during our Unapologetically Black event. She's also been with us for our COVID-19 panel in 2022. And we're really excited to have her back with us this year. She is not just a doctor, she is an advocate for the community. Right from my hometown, the Bronx, she's going to be giving us information about minority health. So you want to stay until the end because this is going to help you and your entire family. Dr. Banks, thank you so much for joining us today.
Thank you so much for having me.
Absolutely. Yeah, we it's always a privilege to be with you, and I do want to formally introduce you and speak to some of your work before we jump into some questions. So Dr. Banks is an assistant professor of biological sciences at the Bronx Community College in New York City, where she also serves as the program director for the Medical Laboratory Technician Program. She earned her PhD in urban education for math, science, and technology from the Graduate Center within the City University of New York. Her research specializes in STEM education, microbiology, epidemiology. I hope I pronounced that right, and
Yes.
science history education. Awesome. Dr. Bings has also co authored many publications, such as The Business of Education, Networks of Powers, and Wealth in America, the American Society for Clinical Laboratory Sciences in 2018, Workforce Shortage Position Paper, and two ASCP LMU webinar courses. Her latest publication is co authored piece entitled Online and In Person Learning Preferences During the COVID-19 Pandemic Among Students Attending the City University of New York. Her work has also been published in Theory, Research, and Action in Urban Education. Dr. Banks' awards and honors include a 2017 through 2018 Science Teaching Fellowship with the American Society for Microbiology. She is a national certification as a medical laboratory scientist from the American Society for Clinical Pathology in 2015 and recognition in the Who's Who of America in the field of clinical laboratory science in 2023. Congratulations for that new recognition, Dr. Banks. And again, we appreciate you for joining us. You are an expert at what you do, and we are blessed to have you on our platform today.
Thank you so much.
Absolutely. So let's jump into some questions. And just for those that are watching, we do want you to share this message out to those that are on your networks, part of your networks. Do share this out, whether you're watching on LinkedIn or Facebook or YouTube. We do want this information to get out. We want to empower our communities to be healthy and to thrive. We also want you to engage throughout this live session. So please put it into the chat box. Any nuggets or anything that resonates with you, we want to also be able to engage with you throughout this time. And today's focus will be on COVID-19 and minority health. So, our first question to you, Dr. Banks, is the COVID-19 pandemic has had lasting effects. We're now in 2023, but over the last 3 years, there has been so much, I guess, harping effects that has stemmed from the COVID-19 pandemic. As a doctor and as in your field, what have you noticed as been the lasting effects of COVID-19? And that could be in any area within your work.
Perfect. I see this question in two parts. The first part is health as an infection, and then the second part is global impacts. Okay, so let's talk about the first one. The first one in terms of health, which is those who have gotten COVID-19 may experience long COVID, right? And long COVID, some of the signs and symptoms of that is fatigue, so the person will feel tired. There's these symptoms of tiredness will get worse after physical and mental effort. We also will see this as in terms of fever, and maybe some respiratory symptoms. So shortness of breath, difficulty breathing. So this is what long COVID would look like. There are some other symptoms that I want to touch on that may also be seen in terms of long lasting effects. And that could be neurological symptoms, right? Or mental health conditions, right? So this could be difficulty thinking or concentrating, having a headache, sleep problems, dizziness, right? When you stand up, pins and needles, feelings of pins and needles in the hands and feet, the loss of smell and taste, or depression and anxiety. Many people often don't associate these with long COVID, but I wanted to point out that these are or could be symptoms of long COVID. And if you've had COVID or if someone had COVID and they're experiencing this, they should definitely have a conversation with their primary care physician to see if they may be experiencing long COVID. Some other symptoms would be joint pain or muscle pain. We're seeing some patients with symptoms, maybe chest pain or fast pounding heartbeats. Right? These all could be signs.
Mhm.
Digestive problems, like someone going through stomach pain or diarrhea. We've also seen blood clots as well. So, very important for people to, if they're feeling pain in their legs specifically, when they get up, when they sit down, when they're laying down, they feel, or they're feeling pain or swelling in the legs. They need to seek medical treatment as soon as possible because they may be suffering from a blood clot.
Mhm.
Now, in terms of the global impact, we're going to see, for example, what we're seeing now, right? One,
Mhm.
a lot of countries are dismissing their vaccine mandate, right?
Yeah.
But we're going to see some things like, oh, well, let me go back. I want to also mention another sign and symptom that I almost forgot. Some people may experience rashes, and some women may experience changes in the menstrual cycle.
Mm.
Although studies have found that it's not at a high rate, we do see that there is an association between the COVID-19 vaccine, specifically the mRNA types, and women disturbances for the menstrual disturbances that women are experiencing.
Mhm.
Um, so I wanted to highlight that because a lot of people don't know. So that is a key point. So if a person is experiencing their menstrual cycle for a month or it's close to 8 weeks, they need to speak with their doctor just to let them know what's going on. Usually, this will pass. The symptom will pass, but being aware of the symptom is very important. Now, going back down to the global impact, we're going to see changes in technology, for example, where people are going to be able to work from home. So many of us are working from home now more often than before. Before, we were going into the office 5 days a week, 6 days a week. Now we're going into the office 70% or 30% of the time, and we're working from home. So
Mhm.
that dynamic is definitely a big change that we're seeing in 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 terms of the effects of COVID. But I want to point something out. Working from home is great and can be great, but we can also see some side effects health wise that we need to be conscious of. So
Okay.
constantly sitting down for 8 hours or 7 hours a day is not good, right? So I recommend that all of us that's home, that's working from home, periodically, every hour, every 45 minutes, whatever is recommended by the CDC, to get up and just stretch. Work out our legs, work out our arms, make sure our circulation system is working well, and do small exercises in between to make sure that we are not just sitting and allowing our blood to pool. Because when we do that, we then develop blood clots. So to prevent blood clots,
Mhm.
we want to get up, shake it up every 60 minutes, 45 to 60 minutes, and sit back down and continue to type.
Wow. That's um that's so insightful. It's like information overload, but it's really good overload of information. But I wanted to go back to the long COVID. You talked about some really important side effects, but I was wondering if you can give us a definition of what is long COVID, who's at risk of getting long COVID, and if you have any underlying health conditions, how does that exasperate the symptoms that you just mentioned?
So, long COVID is experienced by those who were at one point positive for COVID. Not everyone experiences long COVID, but it does increase the risk of experiencing long COVID if someone has a pre-existing condition like diabetes or COPD, for example. What we're seeing is these patients, although they overcome the infection, right, we're still seeing neurological effects, the brain fog on some patients. We're seeing that their joint pain is increased. So what we're offering is the COVID-19 vaccine. The COVID-19 vaccine at one point was showing promising results to reducing the effects of long COVID and preventing long COVID. So that's one way to prevent long COVID. Another way, don't get COVID. And uh, it's very challenging now because a lot of our um, safety mechanisms are being discarded, like masking, right?
Right.
Um, vaccine mandates. But we want everyone to continue to do the basic things, which is hand washing, right?
Mhm.
Washing your hands, sanitizing your hands, making sure that before you put anything in your mouth, your hands are clean. And that's one key area that we can use to prevent COVID. The other thing is, if you're sick, stay home.
Yes.
I've come in contact with so many people that they have COVID, but they feel they have to go to work because going to work is more important
No,
than them staying home, not infecting people.
that's
For many reasons, it could be because they have to pay rent, right? Money is a source of life. Our system is based on capitalism, so they
right.
may feel that they have to work, or they might be the only ones at work, right?
Working home. Right.
One of the global impacts, right? One of the global impacts that we saw is that we had 1 million people die of COVID. And what did that mean? Some of those people had more than one job. So when that one person um, passed away, there were now two job vacancies. And so now we have to fill two jobs as opposed to filling one job. And this is why if you go anywhere in the United States, you're going to see massive signs of we're hiring. Please
Right.
stop in and fill out an application. So
Mm,
this is what we're seeing. So the idea of having long COVID,
wow.
if a person has pre-existing conditions, they need to monitor their symptoms and report that to their doctors.
So this is really good information. You talked about a number of things, the over 1 million people that we lost during COVID, and there certainly has been such a vacancy in a space that's been vacated by the people that we've lost, whether they've played roles as mothers or fathers or grandparents or uncles or aunts or daughters or sons, or business owners or whatever their roles were. They're losing that amount of people and that short amount of time had severe effects on our economy, but also the people, the loved ones, and the caregivers, and the people that these that were lost were connected to. So thinking about it from the workforce aspect of, there are all these vacancies because all these people were unfortunately lost their lives. But then there's the other part of so many people lost loved ones, and that contributes to the declining mental health of many people. And so it really is, it's almost trifold. It's multi-layered, but I love what you're saying here, because I think we move on and we're like, we're done, but we're really not, because there are the effects. There's the process of healing, if you will, that needs to take place. There's still discoveries happening. You just talked about long COVID, which I think it may not be that old. It may be more of a is that more of an emerging sort of discovery, Dr. Banks, the long COVID. There's still
No, we've seen long COVID about year two of the pandemic. We
2000.
noticed that there were people who did not have the infection, that the infection was absent, but they still was seeing um, these effects, and we had to study that what was going on, right?
Right.
And then it was termed long COVID. So
Right.
long COVID's been out for maybe about year two of the pandemic.
Okay. So for about 2 years. So I guess it's still considered somewhat of an emerging I guess concept, and a lot of people are not aware of it. So raising awareness about it is important. There's another issue here that's not on our essentially what we're going to talk about, but it's the fact that not everyone has access to healthcare, to see a doctor, to see their primary care. Not everyone has a primary care doctor because they don't have insurance. These are other issues
Right.
that we also have to deal with as a society to make sure people are staying healthy. Because if you don't know this information and you don't have a doctor to help you to assess you, then you're essentially at risk.
Right.
I'm wondering if there are any resources that are available to those that may not have access to insurance or to a primary care doctor.
Yeah, so that's a great question. And not doing a shameless plug, this is leading, but we have um, facilities that are not associated with a hospital that could help. For example, City MD is
Mhm.
one of those facilities. Outpatient care facilities that are associated with Montefiore, those can help as well. So we do have establishments, but again, you're right. It's challenging when someone does not have um, medical insurance, because even if they go to City MD, they're going to be charged on a sliding scale, right?
Okay.
So we have to resolve for the issue of not having the financial means or access to health insurance. And one way we can do that is by helping or making people aware of the health insurances that we have. The
Right.
American Affordable Care Act
Mhm.
that former President Obama put in place
Right.
helps to resolve some of that gap. It's
Right.
not 100%, but it's definitely helpful. So if we can get people on Medicaid and Medicare, for example, or some type of HMO that's affordable, it might help. But again, some of those copays are high,
Yeah.
so sometimes it's challenging, and we have to do better. We still have to do better to bring equity to our people, especially people of color who are absent of health insurance.
Absolutely. Thank you for bringing that to the forefront. And to those that are in New York City, that was the City MD. Because I don't believe they're
Hmm.
out of state, but I could be wrong. I think they're specific to New York. Is that correct? City MD.
I'm I'm not sure, but I have seen urgent care facilities in other states. They're usually called urgent care facilities,
Got it.
and some are they go by different names, but they're generally urgent care.
Awesome. Thank you for sharing that. And so you mentioned the long COVID. Were there any particular time frames that you've noticed that in patients after having COVID? Was it about 6 months later, a year later? What has the trends been with long COVID?
So you mentioned before that this is new and emerging, right? So we are still in the process of trying to understand a little bit about it.
Yes.
So we've seen people who have experienced long COVIDs 6 months to a year after. We're
Wow.
still seeing people now who had COVID during the onset in 2020 who are still experiencing the brain fog,
Uh,
and the fatigue now. So
wow.
we don't know exactly how long though long COVID will last, but we
Yeah.
do know that for some people it's lasting longer than others.
Wow. Wow, that's definitely very eye-opening. So those that may have gotten COVID, you're listening to this, and they're in some of these symptoms that Dr. Banks mentioned sounds like there are things that you're dealing with. We do encourage you to go to your primary care doctor. And if you don't have one, we would love to put some resources together to the community to be able to look for some type of care so that you can just be healthy. That's what it's all about. And I think a lot of this is preventable when you do have health insurance and you do have a primary care doctor.
I just want to add something to the mix here. In New York City, I'm not sure about any other state, but in New York City specifically, the unions have fought to recognize that if a person, a union member, was at the job and contracted COVID, that they can fill out a workers' compensation form. That workers' compensation form that they fill out also includes the effects of long COVID. So whether they have insurance or not, the workers' compensation can cover any treatment necessary for long COVID.
Awesome. And that's specifically if you were on the job and you contracted COVID on the job, you can fill out a workers' compensation request, and you're eligible to be to have that your treatment covered. So that's great. Thank you for that, Dr. Banks. Hopefully that doesn't happen on the job, but if it does, there is another resource for you all to look into. You also mentioned the global effects, and you talked about uh, the changes in technology, and this is so common. Many people are working from home. Many people are at the computer for long periods of time, maybe not even seeing the sunlight as much. But you talked about being at risk of blood clots and other things when we're just sitting behind a computer. So I really do want to encourage those that are listening that if you are working from home, please, as Dr. Banks advised, get up every 60 minutes and move your body, do a little exercise to keep the blood flowing, because that is important to your health. And I think sometimes we get caught up in work. We're sitting for hours, 7 hours has passed, and we're like, I didn't get up from this chair. Dr. Banks is advising that we do not do that, that we're moving our bodies, that we're staying healthy, whether it's, you're doing a little exercise in your office, or you're moving around, or you're going for a walk, but get away from the computer. Don't stay on that computer for the entire day without taking breaks. It is detrimental to your health. So thank you for that, Dr. Banks. And then also you mentioned on the area of technology. I don't think you touched on this, but I was wondering, are there any technological medical advances that's on the way since the COVID-19 pandemic? Has it changed anything in terms of the experience and the doctor's office experience? Has any of that changed? Are there any new medical technological advances?
I'm not sure about the medical technology advances, but I do know that many offices are still practicing um, physical distancing and masking in the facilities,
Awesome.
um, especially when they're doing forward patient care. Um, but I have not come across any technology specific to COVID-19 um, that would aid in the services that we provide.
Okay. Well, we'll definitely keep an eye out for that. I've seen some, I think, commercials about the care teams that some doctor offices are leaning more towards. And it's almost like you can get everything set up on an app now. And the experience is supposed to be more streamlined. But that may be more private facilities. But I guess we'll keep our eye out for any new advances. And we'll continue to inform the community. So the next question is about the misconception that people have about mental health. I know your industry is more in the realm of medical and STEM, but I'm sure there's also some intersectionality that you've seen in your work between mental health and medical health. Can you speak to any of those intersectionalities that you've noticed in your work?
Yeah, so one big misconception that I've seen is that, and I want to speak specifically to the black and brown community. Um, they feel that mental health or counselors, therapists, etc., pardon me, mental health therapists or counselors cannot help them. They often, but what they're doing is instead of dealing with their trauma, they're trying to avoid it. So we know that we have trauma in the Black and Brown community. One huge trauma, for example, is um, the Tuskegee Airmen experiment, where NIH, a huge, funding source, National Institute of Health,
Mhm.
gave funding to a doctor, a military doctor, who injected Black people with syphilis, and then did not want to give them the medication to cure it, which is penicillin, because the doctor wanted to study the full dynamic of a syphilis infection from onset to death, and that meant a lot of our Black men did not get treated, but also the Black men who were subjected to syphilis also gave it to their wives, and then if they had children, passed it on congenially um, to their children. So it was more effects. It was a web of effects, and this was a funded research, right? So we have trauma, right? We have trauma behind this. How can the
Right.
government allow for this to happen, right? We have right now, you know, Black and brown people that go to the hospital and they say they went for a stomach ache and that person passed away. Those people
Yeah.
that see that, they're like, well, he just went for a stomach ache. I'm not going to the doctor. No, heck no, they're going to try to kill me. So we have these misconceptions going on, but I want people to understand that sometimes their feelings are right, right? But sometimes their fear is wrong,
Yeah.
right? They need to go in and ask questions. They need to go in and be informed. Not going in to get the services that they need can lead to death, right? And
Right.
people wait till the last minute. It may seem like that person died from a stomach ache, but that person may have had stomach cancer. That person may have had stomach aches for 6 months and didn't get it treated, and then went in at the last minute. And I tell patients all the time, don't come in when it's the point of no return,
Right.
because once it's the point of no return, we can't do anything for you. You have to come in earlier. So we have to unpack how Black and brown people feel about the medical industry,
Yeah.
right? And especially now that social media is huge, a lot of these biases that we're seeing in the hospitals are coming out in the forefront now. And so that's also making people feel like, well, I don't want to go because this is going on and that's going on. We need
Right.
to figure out, how do we talk about what's going on? How do we correct what's going on? And how do we gain trust back into the Black and brown community so that they can go to the therapist? A lot of people think, oh, they're going to brainwash me and they're going to make me into a Manchurian candidate, so I don't want to go. And I've heard this from Black people.
Mm.
But what they're doing is they they're coping in other ways, right?
Yeah.
They're coping with street medication like
Yeah.
marijuana and illicit drugs and alcohol, right? So they're not getting rid of their trauma. They're masking it and
Mhm.
using street medication to cope. When, some people, they'll say, oh, marijuana is my form of therapy, my therapist. No, it's not. You need
Right.
someone that you can trust, but we also have to provide resources for them to go to so that they can tap in. And it goes back to the health insurance, right? If you don't have health insurance, or you don't have, 150 to $300 per hour to meet with someone twice a week,
Right.
then a therapist is not accessible. So we need to make mental health and mental awareness more accessible so that more people can tap in. We need to increase the trust level so more people can tap in. And we need to help people understand that coping by using drugs is a negative coping mechanism. And a
Yeah.
positive coping mechanism is to talk it out, overcome the trauma, and move forward from there.
Thank you so much for mentioning all the things that you did, Dr. Banks. You talked about the fear that many Blacks have. I'm thinking of even family members or clients and friends that are so afraid, especially Black men, um, who are just afraid to go to the hospital, or there's a trauma around being in the hospital. And I think there's a deeper level. I think some people have legitimate fears. You talked about the that research that was funded through, and was it NIH? But
NIH.
yeah, but the other part is there's still a lot of medical malpractice going on in Black communities that need to be addressed, that we can't brush over, where people have been medically misdiagnosed. It's not always the client's fault. It's not always they came in last minute. I've heard stories with some of my colleagues who are doctors and nurses, where they have had clients that were coming in for the same issue for years, and they were misdiagnosed. There was medical malpractice, and they were given pills they should have been given. There are all these things that happen. Or when you're Black or you're a person of color, you're more likely to get a pain medication. They're less likely to test you for certain things. So I think this is very, very, these are legitimate and valid fears that people have, Black and brown people, that we have to address. And there has to be some type of restructuring and reimagining of our medical system, so that Black and brown people can feel and be treated the way they deserve. So I think that's a whole nother conversation. But I love that you touched on that fear.
Yes, certainly. And I think that um, this is going to take, it's bigger than what we think, right? And it's going to take a lot of effort to overcome these traumas, right? And what caused the traumas. And so it's going to take everybody that's a stakeholder to make
Yeah.
these changes.
Yeah. And that leads us to our last and closing question: is what does it look like for healthcare to be more equitable for people of color, for Black and brown communities? What does that look like? If you were to give us uh, your world of equitable healthcare for Black and browns, what would that look like?
So I'm going to try to make this quick, but this to me is a loaded question. And it gives me pause every day, right? I daily, I'm thinking about how can we make these changes, but I have several key improvements for healthcare that will make it more equitable and accessible for minorities. So the first one is education. I believe medical schools, we need to correct medical textbooks that lead students to understand that Black and brown people are different from their white counterparts. For
Mm,
example, when it comes to pain tolerance, medical school students are taught African American people have a higher pain tolerance and threshold for pain, and thus require less painkillers. So during a hospital stay, if a Black and brown person is complaining that their pain level is high, they don't get the same treatment that their white counterpart will get in terms of the therapy that they're given. The idea is that if they're asking for painkillers, then they're doing so because they have an affinity of addiction to drugs, as opposed to they really want their pain to be alleviated. So that treatment, I think, education, we need to make sure that the textbooks are equitable, and removing institutional biases from it is
mm,
one key point. The
mhm,
second thing I think is to change in practice. Um, when doctors are in practice, they need to discern racial biases from the truth,
mhm,
right? Right now, we are experiencing a high rate of Black women dying at disproportionate rates after giving birth. This
mm,
is due to doctors and nurse teams not listening to the mothers as they complain or
mm,
explain their signs and symptoms. Not listening to the patient as they complain basically doesn't allow the doctor to treat and respond to the patient's feelings accordingly. Their signs and symptoms are not mitigated. Instead, they believe that they can overcome it because they are Black women and that they're more
mhm,
resilient than their white counterparts.
mm,
Meanwhile, a white woman who's experiencing the same situation, they will get treatment for their signs and symptoms, right?
mm,
And so this is a disparity that we're seeing in healthcare. I
mm,
think these types of racist biases are inherent. They start in the textbooks. They're inherent in the medical schools, and they need to be overturned to equalize the playing field for Black and Brown people. The third thing, I think, um, the work needs to be done in our community or by our minority community. We need to be the change we want to see. For example, I had an opportunity to write a textbook on COVID-19, the virology of COVID.
Please share.
And what I did was I included Dr. Kizmika Corbett into the textbook as one of the Black leading scientists who created the mRNA COVID-19 vaccine. So in our textbooks, we currently see scientists that are German or French or Dutch background. So we need to be the change we want to see. So we need to start authoring these textbooks, authoring these chapters, and then including our people who are doing relevant work in it. And the last thing I think, and it's not certainly not the least, but just in this conversation, I think we need to educate our Black and Brown community on how they should be treated in the hospital, what signs and symptoms to look for when they're coming in, and what treatment they should expect. For example, let's go back to the mother experiencing preeclampsia during childbirth, right? Every single Black family member, including the mother, the husband, they all need to know the signs and symptoms of preeclampsia. And then they need to know what they should expect if that mother to be or that mother is saying, "This is how I feel." What treatment should the nurses and doctor team should give to mitigate that patient's to alleviate that patient's signs and symptoms?
Mhm.
So if all of us are advocating now, we are better at increasing the survival rate. So I want to touch into Serena Williams, for example. Serena Williams gave birth to her first daughter. She felt something was wrong in her chest, right? She had shortness of breath. She kept complaining. She actually had to force the hospital to give her a chest scan. And when they did, they found she had a pulmonary embolism. Had
Okay.
she not forced the doctors to give her a scan, she could have succumbed to the pulmonary embolism. She would have been a statistic in the disproportionate rates that Black women are seeing when they come as disproportionate rates of death when that Black women are seeing. But she advocated for herself. Her husband advocated for her, and they said, "No, this has to happen." And because it happened, they were able to find it, treat it, and she was able to go home with her baby girl. But not
Okay.
everybody is like that. Not everybody is advocating. They don't know what they don't know. So I think it's important for husbands, significant others, family members to understand what they need to look for. So what I'm doing, my hope, right? Because I need to be the change I want to see, is I'm in the process of creating some type of leaflet, just a one flyer information that has all the signs and symptoms that mothers experience during childbirth. And on that leaflet, I'm going to talk about what treatment they should get for each symptom that they have. And
Mhm.
this way, the mother to be, the husbands, the significant others, the father, the mother, the grandparents that's there, they can all take a role in advocating, because now they will know and they will come from a place of knowing. And
Yeah,
this by this, I'm hoping to decrease the disproportionate rate that black and brown women are experiencing when it comes to death after childbirth. I
Dr.
know that
Ben.
was loaded. That was a
That was
loaded question for.
that was outstanding, is what it was, and what it is. It's outstanding. That is what it looks like to have equity, and for us to not accept the terms and conditions that have been handed to us for generations, but to take our power back and say, this is the way we deserve to be treated, and this is what we're going to do. We're not going to wait for the textbooks to be overturned and for institutional biases to be removed. We're going to advocate for that, and we're going to be informed, and we're going to advocate for our family members and caregivers. And kudos to Serena Williams for being able to advocate for herself and her husband, who I believe is Caucasian. Is that correct? Advocated as well. But I
Yes.
think even those individuals, it's the scary part is they're this is a person who is a recognized global star. She's recognized around the world, and even she had to advocate. So how much more For someone that's considered, not known, that doesn't have the money or the resources, will the doctors listen to them? Will they take them
Exactly.
serious? Is really the question that's on my heart, that really breaks my heart, because something in me tells me that they won't always listen to them. And that is where, the training that you mentioned has to come in, where doctors have to be aware of their own biases. It's very disheartening to hear that these things are taught in textbooks, that blacks have a higher threshold for pain. That's why one of the things that I've been working on overdoing, undoing, is this idea of resilience. We've used it as a cop out excuse to
Mhm.
continue instituting racism. It's almost like a legal way to say, we're going to continue institutional racism because you're resilient. This resilience has been so misappropriated. So I've been working to undo the word resilience. We're people, we're human, we bleed the same blood. And no, we don't have a higher threshold for pain. We've had to survive for years because of the conditions, but we don't have a higher threshold for pain. That needs to be removed from textbook immediately. You know, there are some racial medical algorithms that Dr. Lou Hart has talked about, from Yale University. I think he's been working to undo. But there's so many medical racial algorithms that we're so just we don't know about, and they do inform our treatment and our level of care. So yes, this is an institutional restructuring that needs to happen, from our schools to our textbooks to our training to our doctors, to the knowledge that's not given to us, that's not freely, because doctors should give this information. Thank you, Dr. Banks. God bless you for creating a leaflet and for taking us on. But why aren't our doctors and our community health centers creating these pamphlets and disseminating this information out? That's a whole nother issue. So a lot of change needs to happen, but I'm grateful that you are one of the change agents and the medical field that's taken us on, because I do deeply believe that through something like this, through a leaflet that provides this information, through empowering people and giving them the information, this can really save lives. And so I appreciate you for doing that. Thank you so much, Dr. Banks.
Thank you. And thank you for giving me the opportunity to speak truth to power so that we can inform more of our constituents and hopefully help and give them the tools they need to advocate for themselves.
Absolutely. And we're definitely going to connect, and we're going to collaborate on that work, because my goal is to get that information out. And so whatever we can provide to support you, we are your partners. We are officially co-laborers and family. So we want to get that information out and disseminate it wide, once we get to that stage. But we appreciate you, all your knowledge. If there's any, I wanted you to do one thing before we end it. If you can give, because I think you're amazing at these natural remedies, maybe just natural remedies to staying healthy and safe, and protecting ourselves from COVID and other diseases that are going around.
So I've been working on Ceylon cinnamon, or Ceylon cinnamon, Ceylon. Um, Research has shown that Ceylon cinnamon, the organic version, not the genetically modified version, has positive impacts when it comes to cancer. So it has an affinity for cancer cells, and that's the great part. It just attacks just the cancer cell, and it causes the cancer cell to undergo a process called apoptosis. Apoptosis is basically like exploding of the cell. So the cinnamon causes the cancer cell to explode, and then the natural killers, the white blood cells, come and clean up the debris. Um, I've seen so far prostate cancer, stomach cancer, within 30 days of taking the required dose, that the cancer was either gone or reduced from stage 4 to stage 1. We're still looking into the effects and the study. So once I have something sustainable, I'm going to publish that document. But we do know that there are some pharmaceutical companies moving forward with capitalizing on Ceylon cinnamon. So we know that the effects are there, especially when the pharmaceutical companies are tapping into it as well. We're barking up the right tree, basically.
Wow.
So we're looking at trying to solidify the research, solidify the data, and get that out there. I'm also teaming up with someone for medicinal marijuana and their effects on chronic pain and other things. I can't mention much about it because I had to sign an NDA, but just know that we're working to see how well medicinal marijuana will um, work with certain signs and symptoms that people will experience, like chronic pain.
Thank you so much. And then can you just give us the spelling of the Ceylon cinnamon for those that need to jot it down?
Yes, Ceylon, cinnamon, is from Sri Lanka or Sri Lanka, India, off the coast of India. Um, Anywhere else, I don't know. We haven't done a study if the cinnamon from other places, the Ceylon cinnamon from other places work. We know for sure the Ceylon cinnamon from Sri Lanka organic version is the best.
Organic from Sri Lanka, Ceylon, Ceylon, cinnamon. I hope you guys got that. Dr. Banks, you are absolutely a jewel to our community, and we appreciate you so much. There are no words that describe how grateful we are for your partnership and for who you are in our community. So we would like to thank you for your time, for your information, for your expertise, and to encourage you to continue going strong to advocate for our communities because you are absolutely needed. We need more like you, and perhaps you can come back and coach some of our kids. We have a medical program, um, and we try to recruit kids of color into that program. So maybe you could become a coach sometime when you have some free time to give back to our kids. We appreciate you. So, how can people reach you? How can they get in touch with you if they want to reach out?
So I do have an email. It's Diane, Diane, dot Banks, Banks, at BCC for Bronx Community College, dot CUNY for City University of New York, dot edu. So again, that's Diane.Banks at bcc.cuny.edu.
Amazing. So we'll also make sure we get that out there. If anyone wants to reach directly out to Dr. Banks, support her research or any of the things that she's doing, her email is there. So feel free to reach out to her. Again, we thank you, Dr. Banks, and we thank you all for listening and tuning in. We went a little over time today, but we wanted to get the information out. This is about saving lives. This is about making sure you are informed and you have the information needed to be healthy. So Dr. Banks gave us amazing information today. I hope you will take with you and will begin to implement. Talk to your primary care doctor. Again, if you're experiencing any symptoms of long COVID or COVID, we want to make sure that you're connected to a primary care doctor. So if you are not, please reach out. There's a City MD that has a sliding fee where you could potentially get some type of care. But there are many resources out there. You could reach out to us as well at info@iracinc.org. We do have a COVID-19 initiative in partnership with Hispanic Federation. So we'd like to thank Hispanic Federation for their grant and their funding. We have been doing work to educate and raise awareness on the COVID-19 pandemic, the effects, vaccination, and other ways to stay healthy. So please reach out to us at info@iracinc.org. We'd love one of our social workers or care coordinators to connect you with some resources. Thank you again all for listening. We'll be back next week, Wednesday, for Wellness Wednesday. Don't forget our fireside chats every Thursday, as well as our ATL Rise podcast episodes released every Friday. We love you all so much. Stay healthy, stay safe, and we'll see you soon.
Thank you.